Now, those working in the social development sector are now eligible to receive their vaccines. Social Development Minister Lindiwe Zulu and Acting Health Minister Mmamoloko Kubayi are visiting vaccination sites in Tembisa. At the same time, many families have been affected by the looting and unrest from last week, which means the vaccine rollout has also been severely impacted. Let's get an update with eNCA reporter Heidi Giokos. Heidi, thank you for your time. So the Social Development Department has set this ambitious goal of vaccinating, around 240,000 people in just 1 week? Is that possible?
Yeah. Yes, Clement, I must say that it is quite an ambitious target set out by Social Development Department. And we do know that this is going to include the early childhood development sector. We do know that they had been crying out to say that government has neglected them and not considered them in terms of the vaccine rollout because they were not considered under the Basic Education Department's vaccination rollout program. But it seems as though the Minister of Social Development, together with the Acting Minister of Health, they seem quite confident that this target will be met as vaccines are available and they are able to vaccinate a large number of people. As this program is set out, those who want to get the vaccine and are eligible to get the vaccine in social development have been put in a database system that makes it a lot easier to get these vaccines. So we'll just have to wait and see come Friday if this target will be met or not.
Yeah, so obviously there's some concern around vaccine hesitancy. We saw this with the education sector. How concerned is Minister Lindiwe Zulu about this?
Yes, so we posed this question to the Minister to say, especially in basic education, we saw hesitancy. We saw in Gauteng education saying that over 10,000 education staff members were not willing to get the COVID-19 vaccine, and they were urging them to do so, even though it's not compulsory. The department saying that it is life-saving, and because of exposure, it is critical for education staff to get this vaccine. But the Minister saying she's not too worried about this, especially because the early childhood development sector were very eager to get this vaccine. Let's listen to what the Minister had to say about that.
I'm actually not worried about hesitancy because I think the ECD sector, you recall that they themselves were saying, why are we being left behind? That was encouraging enough, and as Minister Kubayi has said, it was a long planning for it. But the fact that they are the ones who are saying we are ready for it, we want to vaccinate because we want to keep ourselves safe, I think they have an appreciation and an understanding beyond themselves. It's about themselves, it's about the children, it's about the families that are also connected to the children. So the two places I've been to, I think here actually we found more ECD practitioners. The other side, there were not so many, but this side we found a lot. And all of them were saying they will also encourage their counterparts, their friends to really vaccinate. I think we've been trying to send the message. Once the vaccines are available, they really have to come in their numbers to make sure that they protect themselves. So I'm not worried about it, but also we will pick up the data. If we realize that the data we're picking up is low, then it means we have a responsibility of communicating and encouraging them to come for vaccination.
So, Heidi, there were places that were storing vaccines, and we know that some of those places were looted. Has the Department of Health managed to quantify those losses in vaccines due to that looting and unrest last week?
So unfortunately, Clements, we don't have the exact number of vaccines that were destroyed due to the looting and unrest, particularly in KZN and here in Gauteng. But we do understand, according to the Acting Health Minister, Mmamoloko Kubayi, that many of the vaccines are delivered the morning of a particular vaccination program or when vaccines are going to be administered. We do understand that vaccination sites, especially the private sites, give a certain amount of vaccines that they will possibly need depending on how many are expected to come into the vaccination site. So they're saying they were able to prevent a huge amount of wastage and destroying of the vaccines because vaccines are kept at a safe and secure place. and then they are transported. What's also key here is the acting Minister of Health saying that the vaccines are transported by police, and there is a very secure process that unfolds when the vaccines are transported to the various vaccination sites. We do know that the acting health minister will have a briefing on Friday, and hopefully we'll be able to get more clarity on how many vaccines were actually destroyed because of the looting and unrest. And also, Clement, in terms of the vaccination sites that were affected, how many have gone back online? Is there still an issue with certain vaccination sites? But if you just look at the figures, Clement, we know last week, Friday, we were supposed to meet a daily target of 250,000 vaccines administered per day, and that dropped down to about 140 vaccines administered per day, slightly picking up now with the new programs coming online, but there's still an urgency to meet that target set by the President of 300,000. So hopefully in the next week or so we can meet that 250,000 mark that the Minister says we should have met last week already.